Meanwhile, the star today is Jubilant Foods. Massive re-rating in that stock. Markets are saying, look, it's not a pizza company, it's a platform company. Network effect is the buzzword now. Whether it is a food company or a pizza company or even hospitals now, we've seen what's happening to the stock prices of Apollo and Fortis of late because they're going more digital. So it gives me great pleasure now to bring on board Mr. Ashutosh Raghuvanshi to talk about the quarter gone by for the hospital, not the quarter gone by on how the COVID crisis hit all of us. Dr. Raghuvanshi, good morning. Fantastic to have you back. And for a change, Dr. Raghuvanshi, we shall not talk about COVID. We shall only talk about operations, Fortis as a company, and the business which you run.
Good morning, Nikunj. It's good to be here.
Let's understand the business dynamics. Now, the quarter gone by was about occupancy levels, which were high because of the COVID crisis, diagnostic business, which saw huge uptick because of the number of testing which was done. How do you think the normal world is looking for Fortis, given that the COVID bump up, which you got in the last quarter, hopefully will not come back?
Yes. So you're right. It is time to move from discussing about COVID because that is not the focus right now. However, I must say, Nikunj, that COVID is here to stay for some time as far as the healthcare industry is concerned. Public health arena will have to remain vigilant about it, and there are possibilities that there may be some peaks and troughs happening over a period of time. However, that has become a part of the normal now. And this particular quarter, as you mentioned, definitely was impacted in a big way by COVID. But I would not say it was a positive bump all the way. It was definitely something where, at least in the hospital side, part of the non-COVID business was compensated by COVID, and hence the overall consolidated results were satisfactory. Whereas on the diagnostic side, as you said, the volume of tests was phenomenally high. So in spite of the fact that it is a low margin business in terms of profitability, but the volumes were very high, and that definitely aided the business to perform well during this quarter. I expect that this will change now. We are already seeing in the last couple of months that the incidence of COVID has come down dramatically, and that is very good for the country. And at the same time, non-COVID work, people who were avoiding elective procedures are coming back to the hospitals in larger numbers. So the pent-up demand is certainly there. And that is going to impact these further quarters positively.
Are you keeping some capacity ready, God forbid, if we have a third wave? So if I'm trying to understand this question, not for your preparedness for third wave, but purely for shareholders. And if you are keeping some capacity ready for the third wave, purely as preparation, could that be unused capacity which could hit your profitability?
Not really, because with the experience of previous two waves, we are now very capable of quickly repurposing areas from one side to the other. So there is no issue as far as the idle capacity is concerned, but we have an ability to quickly turn around if necessary to increase the number of beds for COVID. But at the same time, we have done a lot of other things also on infrastructure. For example, 15 of our hospitals, we are putting up oxygen plants, 8 already in place, and the rest will happen over a period of next 3 to 4 months. So many other steps like that also have been taken on infrastructure side to be able to quickly repurpose beds for whatever is the requirement of the hour.
Dr. Raghuvanshi, if I look at the healthcare sector in India and purely listed companies, diagnostic companies are commanding strong P multiples which consumer companies are commanding. Apollo Hospital is looking at divesting their businesses into separate units of pharmacy and the e-business. Is Fortis now also tempted to consider something where you want to eventually list your diagnostic business separately, because it is a large business, it's a sizable business, and if you take SRL out, the valuation for minority shareholders will only zoom higher?
You're absolutely right, because we have always maintained that SRL is an area which needs to have some value unlock at the right time. So because of all our corporate actions, etc., we are waiting for the right opportunity to do so. But yes, you're absolutely right. SRL, in terms of the business size and the spread across the India, is one of the major players. In terms of revenue, we are only second. And in terms of spread, geographical spread, I think we have a very good fine spread in South India, North, as well as East and West. So that makes SRL a unique player, and it's absolutely true that there is a lot of value in that, and at the appropriate time, we would be taking necessary steps to unlock that value.
Okay, now there is a pending court decision. We will not get into what the outcome of the court decision would be, but if the decision is favorable, how will life change for your business? Are there any expansions? Are there any decisions which you want to implement the minute you get clarity on that decision? Because this is something we'll have to address it, sir. Because every time when I speak to friends, some of your shareholders and analysts who say they have the following feedback, that let the court decision take out, then we will see.
You're right. There is a significant overhang of that on some of the actions which we could take. However, as far as growth is concerned, we are in a pretty comfortable state operationally. And that, as you would have noticed, our debt levels haven't increased, or in spite of the fact that we had a very tough year. And we expect that it will remain so. And within our means of, we would be able to achieve some of the expansion which we had earlier said, which is about 1,300 beds over the next 2 to 3 years. That is completely on track. Other than that, we are getting the next gen oncology technology in NCR region. Especially, we are converting our fMRI facility in Gurugram as a destination oncology center. So that work is absolutely on track. Other than that, we also feel that we have the ability to go for inorganic expansion as well once this is behind us. So that is one of the areas which we would look post the Supreme Court. There are certain structural things in the organization about how it is structured. Those issues have to be addressed. That would also certainly make the organization more efficient. And that will help us in increasing profitability and efficiency in a big way. So those are the areas we would specifically focus in. And a third area, which you have already mentioned, is regarding to our diagnostic business and how it should be taken further to the next level.
Okay. Hi, Dr. Raghuvanshi. This is Mubina as well joining in. How do you think this last 1 odd year, of course, we've seen digital take precedence quite a bit. Lots of diagnostics companies are as well opting for what they call as the phygital model. So I wanted to understand, again, I'll keep it with your diagnostics business. How is that changing things? How is digital consultation as well changing the cost, the reach as well, in fact, for Fortis?
Yes. So there is no doubt that digital is going to play an important role in delivery of healthcare, be it diagnostic, be it hospitals, be it primary care, etc. But the most important role it will play is in the primary care, as well as the interface between the patient and the various components of ecosystem. So I don't believe that one particular part of the ecosystem will address all the needs of the patient journey. There are several components. There is pharmacy supplies, there is video consultations, there is medical record interface, needs of acute and tertiary care in the hospital setting, home testing, diagnostic, which is imaging, etc. So all these components are something which require to be on a digital format. Other than that, it also needs to get interface with the insurance and providers, etc. So that will be the next phase of this whole transformation which will happen in the healthcare industry. And any organization which does not prepare itself for that future will find itself at the wrong end of the stick. So it is important for us as well. And we have certain digital strategy which we are taking, but we are clearly recognize that we are not a technology company. And our focus currently is on acute tertiary care. Hospital care is what is our strength. And then the second strength we have is a large number of physicians who are connected with us, who are tertiary care specialists and can give advice remotely. The third component which we have is the diagnostic sector, which again can provide the home diagnostic as well as it can provide diagnostic centers in the communities. So with all these physical elements, as you said, digital, that is what we already have, and we will build on that. So we are in the process of forming our digital strategy. As you know that at the our promoter company level, at the IHH level also, we have certain initiatives to create a digital platform. And we are currently evaluating how the geography specific thing to India Fortis should do. And we would certainly be coming up with a more detailed plan over the next couple of quarters, where we would see how we link all these components and which are the components on which we focus. We have already started creating our digital platform on an app which we call My Fortis, and that is going to be our main base on which we will create this platform further. As I said, that I strongly believe that it is not possible for one company to really deliver a seamless experience, and there are needs for collaborations and partnerships there. Maybe even possibility of looking at an collaboration or some kind of larger action in terms of going for a digital company per se. So it could be a reverse of what has happened in past, where one of the traditional company may go for acquiring some digital company. So those all options are on the table. We need to be very focused, and we need to have a profitable journey to transform ourselves into a meaningful digital provider. So that is what we are focusing on. We are focusing on our strengths right now and how we leverage digital to deliver that better and more efficient and make the patient experience better.
Dr. Raghuvanshi, just to pick up from something that you said, we could be looking at a reversal of what used to traditionally happen. That's, a traditional company picking up, or buying a digital-oriented company. So was that a hint of something that, you are looking at? You mentioned you're going to obviously expand on the digital business. You have inorganic opportunities as well lined up post the court case. So if you could, just share a little bit on that. Is that an acquisition that's on your cards, something on the digital diagnostics healthcare space?
See, we have to think of the right path for future. And as I said that, other than the organic growth we are expecting in our hospitals and the diagnostic side, we will look for non-traditional ways of growing as well. And this could very well be a part of it. There is nothing specific to share right now, but definitely there are possibilities on that side.
Dr. Raghuvanshi, if we are in a normal world, and let's hope and pray that there is no third wave and we are in a normal world, what happens to your business? Will the per capita spend on healthcare change disproportionately and the growth rates will change? Or will it be back to the pre March 2020 growth rates?
So what I believe is that the coverages will improve. The one of the major changes which we are already seeing taking place is that the insurance coverages, or rather sometimes scheme coverage, is enhancing. So self-pay patients are becoming lesser, and the patients where a payer is involved, either a TPA insurance or a scheme, those numbers are increasing. So what I believe will happen is that the market size will increase, because healthcare will become more accessible, private healthcare will become more accessible, I should say, to larger number of individuals. And as a result of that, the market size would increase, addressable population will be much more. I expect that there would be continued pressure on the price, on because in a country like India, I think there is a lot of sensitivity about what the cost of healthcare is. And I think it is important for us to consider models which are more volume driven and are not so much dependent on the pricing power. And quality is paramount as well. So these are the focus areas on which we are looking at. I expect that the prices will remain under pressure, and there will be a change in the payer profile. So that will dictate how the industry shapes up in future. And that's why I said earlier that collaboration with insurance providers and government is extremely vital for a healthy private healthcare industry.
Dr. Raghuvanshi, it was an absolute pleasure speaking with you this morning. Thank you very much for joining us on ET Now.
Thank you for having me.